Best supportive care is a plan of care you need now or in the future because treatment for your lung cancer is not possible. The aim is to help you and your family or carers manage the symptoms of lung cancer as they happen so that you have a good quality of life for as long as possible. The care may be provided by lung cancer nurse specialists, your GP, community teams and social services. You'll have met a lung cancer nurse specialist who will be your key worker when you attend the clinic for your consultation with the chest doctor. Or they may phone you to introduce themselves as your key worker. You can contact them with any questions or concerns about your lung cancer, and they can refer you to the community services as needed. We'll let your GP practice know that you've been diagnosed with lung cancer and that you're receiving best supportive care. They should contact you to arrange a cancer care review, which will include discussions about your care going forward. You should contact your GP if you get any symptoms while you're at home. They can also refer you to other services. Community teams help you to keep independent at home. These are community nurses, district nurses, palliative care nurses and therapists. Your GP practice or lung cancer nurse specialist will refer you to these teams as and when required. The palliative care team have special skills in pain control and symptom management. They work in hospitals, in the community, and in specialist units such as hospices. They work closely with your GP and district nurse to ensure that you get the best possible care and support in your own home. If you or your family feel you need support at home during the night, the community nurses can refer you to the relevant services. If hospice care is required for symptom control, this can be provided in an outpatient clinic or an inpatient stay. Day therapy units also run different activities. This may be slightly different depending on where you live. Please discuss this with your GP or lung cancer nurse specialist. The social services team can assess you if you're struggling to manage at home, for example with washing and dressing. They can assess your need for specialist care and equipment that may be needed to help you maintain your independence at home. You can contact them yourselves or via your GP practice or lung cancer nurse specialist. There are also other ways to get help. If you're having difficulty walking about outside your home, your nurse or your GP practice can refer you for a wheelchair assessment. Services may differ for each area, but your healthcare team can advise you. We can also help you to get a blue badge to allow you to park in disabled bays. The Macmillan Welfare Benefits Team, or Age UK, can offer help with benefit checks, filling in application forms and managing claims. We may be able to fast-track your claim under special rules. Your GP or lung cancer nurse specialist can arrange this for you. This involves completing an SR1 form. You qualify for free prescriptions because of your lung cancer diagnosis. Your lung cancer nurse specialist or GP can provide you with a prescription exemption form. Lung cancer can have an emotional impact on you and those around you. Sometimes it's not easy to talk about how you're feeling with those closest to you. You can talk to your lung cancer nurse specialist or GP, and they can refer you for counselling or signpost you to an appropriate support service. There's also support available for family or carers if needed. Although this may feel extremely daunting, please be reassured that we have a team of healthcare professionals both in the hospital and in the community who can help you manage any symptoms you may experience. The aim of best supportive care is to achieve the best quality of life for you and support you to continue to enjoy the things that are important to you. Thanks for watching this video. To find out more about your lung cancer treatment pathway, watch the other videos in this series.